Well, good morning. And I'm going to ask everyone who's standing if they could find a spot to sit. Well, I'd first like to thank everyone who's here, and more importantly, who's here on time. We've got a large number of registrants who have either been deterred by the weather or other schedule issues. So I expect over the course of the day, we'll see people trickling in. But we decided to go ahead and start because today is first the kickoff of the 9th annual HIT Lab Summit. So we've done this, excuse me, we've done this 9 times. During the period of the COVID, we did it virtually, but we still contain the discipline of having an annual discussion around the value of innovation in healthcare. And today will be like all the others. We're going to explore, discuss, and celebrate digital health, and more importantly, digital health as a shorthand for how technology-enabled innovation is driving change in healthcare. Over the last 20 years, HIT Lab has conducted 700 projects for our sponsors, and those 700 projects have all focused on, focused on the question of how do we make improvements in healthcare, and how do we use technology as an important component of that value improvement. And so I'm going to say, first, we've learned a lot about what works, what doesn't work, what wanted to work but didn't, so you learn from failure as well. And so there's some key issues of success I'm going to ask for you to think about during the 18 different sessions we're going to have today. So think about it. In the next 7 hours, not counting lunch and breaks, we're going to have 18 different sessions and discussions, presentations, dialogue, exchanges of points of view, and more importantly, an interesting presentation of some very ambitious young entrepreneurial businesses who are wanting to make a difference in healthcare. So it's going to be a rich and very, very varied day. But from my perspective, some of the important things to keep in mind are the kinds of things that we answer for our sponsors. HIT Lab answers for its sponsors. First, can something work? Is this concept, is this idea, is this ambition plausible? So can it work? The second question that shortly follows, if we think it can work, is will it work? Will the chosen components that need to work together to produce new value in some fashion actually integrate, actually connect, actually bring about changes in behavior, changes in therapeutic outcomes? The critical question that comes as third is, does it work? Can you actually collect and show evidence that the introduction of technology-enabled innovation bring about changes in clinical outcomes, bring about changes in economic outcomes? What is the evidence? And we go at it with the rigor of clinical investigations. Does it work to try to prove the case? Because, excuse me, not enough coffee. And oh, by the way, I live in Florida, so this is tough on my sinuses up here. There's 2 dimensions of value that should be proven. First, value of outcomes, and then secondly, economic value. Because the question is, not only does it work in terms of producing value for patients or value for institutions, but who's going to pay for it? So as a patient, I want to be taken care of, but someone else pays for taking care of me in most cases, whether it's the government or whether it's insurance or whether it's employers. The question that follows that proof is this a sustainable business? Not is it a sustainable technology, but is it a sustainable business? Is this a business that can view it view its value proposition in terms of a market, view its value proposition in terms of the economic forces that have got to be maintained to create what I'll call a gross margin outcome. And then finally, what will it take to accelerate diffusion? Because with hundreds of solutions fighting for market space, what you want is rapid diffusion of the best ideas, because those are the ones that will become sustainable. So those 5 questions: can it work? Will it work? Does it work? Is it sustainable? And what will it take to accelerate it? Are fundamental, not just to the work that HitLab does, but more importantly, fundamental to everything that's going on in the world of innovation in healthcare. So to illustrate innovation in healthcare, we've invited this morning the CEO of FFF Enterprises, Patrick Schmidt, to tell us a little bit about their ambition, about their progress, about their intentions, and how they're going about embracing innovation in their business. Now, for those of you who don't know FFF, they have a very interesting tagline: helping healthcare care. They're in the business of supporting the delivery of healthcare, to those people who are most in need. They're a leading supplier of critical care biopharmaceuticals, plasma products, and vaccines. They've been in business for 35 years. They're a $3 billion privately held company. And they have chosen in the last year or so to actually aggressively establish a vector of innovation within their organization to take the best ideas for serving their patients and their customers and turn them into really useful new solutions that augment and flank the core businesses of FFF. So I'm going to ask Patrick to join us up here and share his thoughts on how does a well-established company aggressively embrace digital healthcare. Patrick.
John, thank you for the kind words and welcome and good morning. Today's, in case you're not aware, is Giving Thursday. To those who've been given much are responsible for much, so dig deep and give heartily today. As John said, my name is Patrick Schmidt. I'm the Chief Executive of FFF Enterprises, or 3F or Triple F. It's kind of hard to say. John, you did a great job. And the parent of FFF, our wholesale division, Newfactor, RNI Technology, which we have displayed in the lobby, Encircle, and most recently, ClearTrust. I hope everyone had a beautiful and peaceful Thanksgiving holiday. Unfortunately, we know not everybody did. So thank you for this morning, for coming this morning. Allow me to spend a few times with you at the beginning of HitLab's 2022 Innovators Summit on the beautiful campus of Columbia University. As I was preparing for the event over the past several days, I thought it made sense to learn a little bit more about Columbia University. So thanks to Wikipedia, I discovered Columbia, established in 1754, has a $13.3 billion endowment fund, among the largest of any academic institution. Its illustrious alumni, faculty, and staff has included 7 founding fathers of the United States, 4 U.S. presidents, 33 foreign heads of state, 2 secretaries generals of the United Nations, 10 Supreme Court justices, 100 Nobel laureates, 125 National Academy of Science members, and I find this one interesting, 53 living billionaires, 22 Olympic medalists, 33 Academy Award winners, 125 Pulitzer Prize winners, and importantly, what brings us here today, an accelerator labs for technology firms. So it seems appropriate at this time to thank Stan Kashnowski, Jerry Antimano, and again, John Hammett, and the faculty at HitLabs for inviting us here this morning. So how did a company you likely never heard of, founded by a man you certainly never met or heard of, having played for 2 NFL Hall of Fame inducted football coaches, end up here today? That's the same question I'm asking myself. There is only one plausible cause: providence, divine providence. These are the lens I see the world through. It is in the same spirit of Columbia University's motto, "In thy light shall we see light." Beginning with a $100 investment in 1988, in a similar spirit expressed in the English translation of our Latin motto, fortune favors fortitude, FFF was born. Not with the intent of being here today, FFF began as a means to an end. That end, my life plan, was to coach professional football. We created FFF during a severe shortage of patient examination gloves in 1988. Some of us are old enough to remember when dentists would work on you without gloves on. And so the shortage was caused by the CDC's release of universal precautions against HIV. Our plan was to borrow $80,000 from an Italian friend of mine, buy one container of exam gloves, split $20,000 in profit, and coach football for the rest of my life. In retrospect, it was the first unmet healthcare need we thought we had identified. It wasn't. Thousands of other people were ahead of us, and by the time our imported container arrived, the shortage had long been resolved. Having to quickly scramble to modify our original plan, remember, we're on the hook for the $80,000 from the Italian guy, we identified a company that operated 700 dialysis clinics. Having found the person in the organization responsible for purchasing exam gloves, we learned abruptly from her they're coming out of our ears too. It was at this point I asked a divinely inspired question that changed my life. What would you buy if we had it? Had she not answered, we, and all our teammates here from FFF today would not be here. Since then, I've dedicated over half my life to doing God's work to fulfill seemingly endless unmet needs, helping healthcare care for patients. You will not hear me utter or aspire to disintermediation or disruption. An unmet need is something someone else cannot do or won't do. It really is a matter of will, or as my mom used to say, when there is a will, there is a way, especially if it's God's will. Likewise, if we had chosen any other name besides FFF, we certainly would not be here today. This is why we believe providence is at work in our improbable existence. However, the whole tale is for another day and another time. From our very humble beginnings in the spare bedroom of a rented house, we have steadfastly focused on finding solutions to fulfilling unmet needs in healthcare distribution, high-touch home infusion, specialty pharmacy, for deployment of critical care pharmaceuticals and biologics to save countless lives, speed time to therapy, reducing the cost of care while improving healthcare's ability to care for patients. We recognized long ago that technology was a business accelerator. We have invested tens of millions of dollars in state-of-the-art ERP systems, warehouse management systems, e-commerce, cloud, distributed workplace communication systems, CRM, AI, and ML. We are intent on digitizing the pharmaceutical supply chain, bringing visibility and transparency to a broken and deceptive drug distribution system. From a 7-year self-funded study named Insights, acronym for Immunological and Neurological Study of Immune Globulin Habits, Treatments, and Standards, we applied our surprising study conclusions and built algorithms to help insurers identify $2.5 billion of potential waste in a $12 billion therapeutic category of a finite, precious resource. Later in the conference, you will have the opportunity virtually to meet Dr. Todd Levine. He and a colleague, Dr. Jonathan Katz, were the inspiration behind our clinical decision support system and wholly owned subsidiary named InCircle. It started very simply with Patrick, there is a need to collect data suggested by Dr. Levine, another unmet need. In case you're not aware, as I was not, InCircle is a geometric term describing the largest circle that fits inside a triangle, visually depicting the patient as the circle, touching 3 sides of the triangle, each side representing the payer, provider, and producer of the drugs, sophisticated medical device, or digital therapeutic. InCircle's mission and purpose are simple. Make sure the right patient will respond to the right drug and eliminate what one payer/customer referred to as unrighteous spend or wasteful spend. I have personally sat in meetings where payer executives had made statements to the effect that all specialty drugs using an InCircle-like system will be prior authorized this way in the future. From our perspective, it is fundamentally much more profound. We believe everyone in America and on the planet should have access to medical and clinical experts in every disease and therapeutic area. Everyone includes everyone, no matter what you look like, where you live, how much money you make, and who you choose to love. We all deserve expert medical and clinical oversight. Only through technology can this be enabled. We were inspired recently to take a step further in this direction after hearing a medical director from a large national payer participate on a panel at the recent Association of Value-Based Cancer Care held here in New York City in October. He said, prior authorization and utilization management are the blunt instruments we have at our disposal as a payer. How does it make you feel that we're using blunt instruments to determine who and what gets covered by insurers? It did not exactly make my confidence soar. I internalize everything. What if it were my loved ones, or what if it was me or my loved ones around the receiving end of that coverage determination? FFF's investment in ClearTrust and Encircle is our information technology response to replace the blunt instruments payers are using. We want to help payers manage the impossible task of managing increasingly costly and complex therapies. So don't miss Scott Kornhauser, EVP of ClearTrust, and Bert Zwigenhoff's session later today, which will describe in more detail our value-based contracting application. We believe this has the potential to obsolete the current cumbersome prior authorization process, speeding time to therapy initiation, which translates into money and life saved. Many of you may recognize Bert as the founder of AVBCC. He is also a dear friend of mine here in the front, and Scott's right over there. Thank you, Scott. So changing gears a little bit, how many of you know someone who is struggling with substance abuse who may be in danger of a drug or fentanyl poisoning overdose? Do you know we're on track for 148,000 people to die from drug overdoses in the next year? I woke up yesterday morning to yet another daily article about the drug overdose epidemic. This one on why Black men are dying at an alarming rate from drug overdoses. 148,000 from all walks of life this year and 107,000 last year. This is the public health crisis of our time. Many of these deaths are preventable. The reversal agent, nasal naloxone spray, needs to be within an arm's reach of every overdose emergency episode possible, free of charge. Sadly, this is the most shocking and unexpected unmet need we've discovered in our 34-year history. It is something I am personally spending much of my time on. I am reminded of the passage from the book of Esther in the Old Testament, where Mordecai said to Esther, "Who knows if perhaps you were made for such a time as this?" I feel we have been specifically called to use the distribution, dispensing, and information technology assets we have assembled, created, developed, and deployed to reverse the insidious tide of overdose deaths, a national epidemic of epic proportions. You cannot rehabilitate and help people from the strongholds of addiction unless you rescue them from the overdose episode that is within minutes of ending their lives and shattering others. Later today, our Chief Operating Officer, Shay Reed, will share with you our set of Right Now Inventory Technology Solutions, R&I for short. Joining Shay will be Brad Foltz, who leads the initiative for us as our VP and General Manager. They will be showcasing in the lobby our R&I Secure Cabinet. We are in the process of standing up 36 forward deployed, connected micro 3PL sites around the country for rare, critical, expensive medical devices and specialty drugs that require special handling and storage solutions to be nearby the patients needing these treatments. While not specifically designed to address the opioid overdose crisis, our R&I Secure Cabinet has unparalleled capabilities, innovations, and use cases that Brad and Shay will share with you later. Our other R&I technology solutions, R&I Ready and R&I Cloud, are assets we intend to deploy to combat the opioid overdose crisis. We will be able to know exactly how much naloxone is in each location, the lot number, expiration date, and how much has been dispensed into a community, either through our wholesale channel, FFF, or our discrete direct-to-consumer channel, New Factor. This data shockingly does not exist today. Currently, there is no way to measure effectiveness or fragility of access to overdose reversal medications. We are blind to the information. Our technology will provide the needed visibility and automatic replenishment. Our goal is to share this information with HIDA's OD map that tracks and issues overdose spike alerts to subscribers around the country. Our data will allow OD map to create an naloxone overlay able to match naloxone availability with overdose spike alerts. In case you are not aware, HIDA stands for High Intensity Drug Trafficking Area. There are 32 areas designated as such in the United States. Think of a spike alert as smoke that rises from a fire. With our technology, we'll be able to in real time to identify the exact location and amount of naloxone in the vicinity of dangerous fentanyl-laced drug overdoses, and in essence, put water directly on the fire. Another unmet need. Remember, unmet need is cannot or will not, thus saving lives. I'd like to make one thing abundantly clear. We are not attempting to create a solution to a problem we help cause. We, as a specialty distributor licensed in all 50 states, did not ship hundreds of millions of opioids and unchecked suspicious orders to cities, counties, and states, which in the words of Sam Quinones, author of Dreamland, the book telling the story of how the opioid crisis began, characterized such uncontrolled distribution as tenderizing a whole new generation of addicts. In fact, we have an unblemished regulatory distribution history, and today marks the 12,563rd day of counterfeit-free drug distribution from our nationwide network of state-of-the-art distribution and dispensing pharmacies. We consider our network hallowed ground. No other wholesaler of our size or scope can make or support such a claim. Our very disciplined distribution model of buying only from pharma manufacturers and shipping only to licensed providers, had everyone adopted it, would have precluded the need for a federal drug security supply chain act. So I would like to thank Stan again and the faculty here at Columbia University Hit Lab for inviting us and encouraging us to share a little bit about the leading edge solutions and the problems we're trying to help solve. They have helped guide and persuade us to launch our own innovation hub we're calling Forum Innovations. Forum, a space where ideas can be exchanged, a medium for open discussions, powered by FFF and spelled with 3 Fs. I bet you saw that coming. Our logo, FFF, looking to the future, looking to the horizon, our future plus innovation. John Hahn, our CIO, and Todd Augustine, our VP of Digital Health and Analytics, first proposed the idea of an innovation hub when they committed, I think promised, by doing so, we could move faster and more cost effectively. It was the cost effectiveness that caught my attention and convinced me. So their further encouragement, along with Wayne Tuller, our CFO, who could not be here today, led us to accept this invitation to share with you this morning. So thank you, John and Todd and Wayne, who's not here. I would also like to acknowledge our General Counsel, Aya Salim, who still relatively new to our ranks, is here with us this morning, coming from nearby New Jersey, who without the pandemic opening our minds and horizons to consider senior, highly qualified remote participants would likely not be here today. So welcome, Aya. Like all of our team, all of our amazing team, you have all been such a delightful blessing. Providence yet again, God Almighty still in charge. So from our initial $100 investment, we have grown to a multi-billion-dollar private enterprise, and by the grace of God, attracted and retained talented, experienced, loving, and caring teammates, all deeply committed to helping healthcare care. Thank you again for your time and attention this morning. It's been an honor to speak with you. So may God bless the rest of this day, the days ahead, and all the rest of your days, no matter how many they're numbered. So thank you very much.
That is a fantastic kickoff speech and talk for such an important meeting. The first time in 3 years that we've had this Digital Health Summit live in person in New York City. New York City is back and it's open. And many of you I know stayed here last night who flew in from out of town and have already told stories about being in Times Square, being back on the West Side, being back in central New York, and Midtown, and just seeing how alive it is. And it's great to have everyone here. And we couldn't have done this without our tremendous support. Then support provided by FFF, provided by Merck Global Innovation Fund, by Fenwick, and by Piper, and certainly Playing Forward, and all the good folks at MRG and Recovery Response, Information Media Corporation, and BlockCube, the blockchain clinical trials company. So many sponsors and so many people supported us in bringing this together. So thank them. Just a round of applause for the people who supported this.